Hey, welcome to the Nursing Dose with your host, Farah, aka Dr. Laurent. Today, I wanted to come on and talk to you about the importance of interviewing your future employer, specifically as a new graduate nurse. So, why is this different than what everybody else is saying? Everybody keeps really emphasizing, you need to get your first job, just get the experience, get into med surge or get into the hospital. But I'm here to tell you the opposite, right? So for those who've been following me, you know that I'm a big advocate on telling new nurses and nursing students to follow what it is that they want to do. Follow your dream, follow the specialty area that speaks to you, that you want to work in, that gets you excited, that is going to fulfill you and really make that impact that you want to make in nursing and in healthcare. All right. And I'm going to tell you always do not settle just for any job. Do not settle just for a job or any employer. Okay. So these are going to be a couple tips that I share with you. I dropped in my newsletter earlier, but I'm just going to give you a little bit more tips as I talk about them today. All right. So, why is this so important? Because the game in nursing is changing. Your mentality and your mindset has to change because I was just reading a survey from Press Ganey that talked about basically the experience of nurses, entering the workforce. So, 1 in 4 nurses are leaving the profession. And these are Gen Zs, right? These new nurses that are coming into the workforce. So, this is why it's so important for you as a new nurse and a nursing student to do your homework and to start vetting these future employers, right? You have a lot of knowledge. You've invested a lot of time in nursing school, and you will invest a lot in this future employer. So, it needs to be a win-win for both of you. So these are a few things that you need to look for. And I'm going to share those 5 key areas with you in just a moment. For those who don't know me, my name is Farah. I'm a nurse career coach, and I've been helping new graduate nurses and nursing students land their dream job in less than 90 days for about 4 years now. Why do I do this? Because it stemmed from my own experience as a nursing student when they told me that I would never be an emergency nurse. And of course, I didn't listen to it and pursued emergency nursing. It was the best decision I ever made. So I saw a gap in the marketplace. I was like, there's nothing like this out here. I wish that I had a nurse career coach when I first started. So this is what I do today, is help new nurses like yourself with some clarity, confidence, so that you can start your new roles with confidence and that you feel fulfilled and that you are in the right place. Okay. So, this is my contribution to nursing and to healthcare to make sure that we retain nurses because they need to be in the right organizations, doing the right thing in the right positions. All right. So, if you want to learn more how to work with me and how to land your dream job in less than 90 days, DM me. You can direct message me here on LinkedIn. If you happen to be watching Facebook or YouTube, same thing. DM me on LinkedIn or go to my website, nursefair.com, and you can schedule a call with me. All right, so let's get into it. Number one thing you need to know as a new nurse: does this organization have a residency program or a structured orientation program? Let's say you're not even going in the hospital, you're going in the community setting, public health, whatever that is, a clinic, outpatient setting, whatever you're going into. Do they have a structured orientation program? What does this program look like? How is it broken down in terms of time and also topics? What topics are they covering? Who's teaching you? Do you have a preceptor? How long are you with this preceptor? Does this preceptor actually have a preceptor program that they had to be a part of? Or are they just selecting preceptors randomly with no training and having you precept with them? What does the orientation look like? So in your interview, and even before your interview, you need to look that up. You need to find out from other nurses who've been through that residency program or at their organization what their onboarding looks like, right? And when I say onboarding, it's from anywhere from how you speak to the recruiter, how their process is, how many interviews do you have, what does the interview process look like, how are they treating you during the interview, are they constantly canceling things, super unorganized, how does it look, how does it feel, because that could be foreshadowing for future. All right, so that's number one. If they can't speak to the orientation, what it looks like, what it entails, then that's a red flag. Number two, how is nurse safety or mental health supported in this organization, right? So do they have mentorship programs after your residency program? Are you going to be paired up with a buddy or a coach that's going to check in on you in your transition after you're done? Or is an educator going to be checking in on you? What does that process look like? Are they going to have monthly meetings with you as you're transitioning to practice, right? Do they have a formal mentorship program? Okay. And then also from a mental health standpoint, well, number one, are they even offering things like a relief nurse that's going to relieve you for break? How does your vacation look like? How do you request for time off? Do they have a non-punitive reporting system? So a lot of places have something called just culture, right? But is it just on paper to look good? Or are they actually doing what they say they're going to do to support nurses? Okay. So that's extremely important. And then number three, what really is the nurse-patient ratio? And for some of you that are not maybe at the bedside or in the hospital, just look at it in terms of the workload. What does the workload look like, right? And I'm not saying to go and ask that directly in the interview, but you can ask a typical question like, what does a day of work look like in this organization, this facility? Can you walk me through a typical day? That should be able to kind of give you a hint as to what that looks like. If they're asking you a lot of questions in the interview, like how do you work under pressure and under stress? And if there's tight deadlines, how do you work, how do you work on that? Those are all red flags that something is not right, right? So really do your homework, ask other nurses, especially if it's a unit where you're offering direct patient care and delivering care. Ask to tour the unit to see what it looks like and things like that. Okay. I remember one time as a travel nurse, I was on the phone with the recruiter and she was like, yeah, so the emergency room, the ratio is about 12-1. And I was like, if they're telling me on the phone it's 12-1, then it's probably more like 15 or more in person, right? So you definitely want to do your homework. And if it doesn't sound right, then, ask more questions. If this is resonating with you, if you happen to be watching, if you have any comments, questions, drop them in the chat. Let me know where you're watching from, what city, what country. And if you're just joining me, I'm talking to all my new graduates out there who just graduated or maybe are still looking for a new position as a new nurse. I know it can be discouraging sometimes if you're getting a couple of rejections. Maybe you're not passing through the interviews. It's getting a little bit rough in the job search. I want you to have faith. Do not settle for any job. Don't get desperate and just take anything. I want you to be safe and to be in a supportive environment where you can transition and be successful. Okay. So like I said, if you want to learn more on how to work with me, just direct message me or go to my website, nursefarah.com, schedule a consultation. All right. So number 4, what is the unit culture like, or the hospital culture, or the facility or organization? Let's say you're not working bedside. You still need to figure out what that culture looks like. Every unit might have a different culture, and there might be like subcultures. Basically, it's like I always say, what's the vibe of the place? Are they respectful? Are they supportive? Is it a healthy work environment? That's really what you want to look at. Healthy work environments are going to be supportive in terms of your transition of practice. They're going to help you. Let's say you need more time off orientation. Before you get off orientation, they will give you more time, right? Those types of things. Those are things that you need to find out. And look at their turnover rate. If they have a super high turnover rate, meaning nurses continuously are not staying in that unit or that hospital, or even their leadership has a high turnover rate. And I understand some organizations, change every couple of years, or there's different changes going on, and that's okay. But I'm saying if there's like a significant amount of turnover, that's a red flag that you should not be at that organization because it's unstable. Okay? And then number 5, are there growth opportunities? So meaning mentorship programs, clinical ladder programs where you're able to do different projects, or after a couple of years, you're going up the chain. Transition to practice programs. Let's say you are a critical care nurse and you're like, you know what, I don't want to do this anymore after 2-3 years. I want to go to the ER, whatever it is. Do they have programs that will help you transition between units? Okay. And do they have a preceptorship program that's like an actual program through an outside third entity, or is it accredited by ANCC? Things like that. Is it a magnet hospital? And sometimes magnet hospitals on paper might look great. However, there might be units in there that you don't want to be a part of. So that's where I'm saying do your homework. So if this was helpful, please let me know. I'm going to drop more newsletters, more content for new graduate nurses, especially during this time, since so many of you are graduating and looking for jobs. And again, I'm a nurse career coach. I've helped over 100 nurses land their dream job. If this resonates with you, you need some guidance in the job search process, just message me. And then let me know if there's any particular topics that you want me to cover in terms of interviews, job search, or anything related to nursing. And I may do a live about it next time or do a newsletter. All right. So please subscribe to my newsletter. I have 2 newsletters, Nurses Making Money Moves and The New Bold Nurse. You can also subscribe to my Nursing Dose channel on YouTube, The Nursing Dose with Farah, which is my podcast. And of course, you could subscribe to my mailing list on nursefarah.com, which is my actual website. All right, if this was helpful, let me know. Until next time, have a great day, and I'll talk to you soon. Take care.